be conducting a series of tests for cervical radiculopathy. The first test I will be doing is a cervical rotation range of motion. I'm doing this because patients with cervical radiculopathy commonly have limited rotation to the side of their pain and a little bit of provocation of those painful symptoms. A patient with cervical radiculopathy will have unilateral neck pain and some numbness and tingling down that side of their arm, right or left. So rotation, I will be setting up the stationary arm of the goniometer parallel with the lateral acromion. I will start with the left side. I will set the moving arm bisecting the cranium and the axis of rotation, or the axis of rotation bisecting the cranium, and then the moving arm parallel with the nose. All right, Mickey, go ahead and turn to the left. So we have about 70 degrees of rotation on that side, which is well within normal limits. So on the next side, set it up parallel to the nose, lateral to the acromion. All right, go ahead and turn to your right.
Oh. Right about there, it hurts.
Okay. So we have about 45 degrees of range of motion in that, which is limited, which is expected with someone with cervical radiculopathy on her right side. The MMT that I will be conducting for this patient will be a cervical extension MMT. This will test some of those deep cervical extensors, which may be limiting some of her range of motion issues, and could also provoke some of that pain that she's having as well. So, Nikki, what I'm going to have you do is go ahead and lift your head up. All right, so she clears the surface, and now I'm going to apply resistance. Go ahead and resist my movement.
Oh.
Does that hurt?
Yep.
Okay, so she completely broke against any sort of resistance, so that would be a 3 out of 5 for that. Now I will be doing an upper limb tension test for a special test for this patient with signs and symptoms of cervical radiculopathy. So I'm doing this test to see if she gets any of that same reproduction of pain in the nerve going along that arm on the right side. This will also help conduct further exercise treatments, and potentially with a positive test, we could do some nerve slides in therapy, but we're looking for reproduction of symptoms on that right side and a range of motion difference of at least 10 degrees between the two sides. So I'm going to start with the left first. So Mickey, what I'm going to do is go ahead and bring your arm right to about here. And then from here, what I'm going to do is kind of hold your hand, and I'm going to take you in all the way back. You just tell me when you feel any pain.
It's good.
Good?
Yep.
Still okay?
Yep.
All right. Right, so she gets through about full range on that. Now I will be doing the upper limb tension test on the right side. Okay, so I'm going to go ahead and bring your arm out. You just tell me if at any point you feel any pain, okay?
Oh, it starts to get really sore right there.
Sore right here?
Oh, yeah.
Pain?
Yep, yep.
Go ahead and bend the side of your neck towards me.
Like straight? Oh.
Bend it, bring your ear to your shoulder. Does that feel better?
It's still really tight.
Still really tight? Okay. So that was definitely more than a 10-degree difference, and she did have a reproduction of pains with that, so that is a positive special test. For the final special test that I'll be conducting, I will be doing the Sperling's test. So for this, we are looking for reproduction of pain with the overpressure on the patient's neck. So for this, I'm going to start with the left side. So Mickey, what I want you to do is go ahead and bring your left ear to your left shoulder and rotate your head at the same time. Good, hold that. Now I'm just going to apply some pressure. Any pain with that?
No.
Okay, now we're going to go ahead and do the right side. So go ahead and bend your ear down to that side and rotate it just a little bit. Now I'm gonna apply some pressure. Okay. So after applying pressure, she did feel reproduction of pain on that right side, which would be another positive test for cervical radiculopathy.